Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The operation of a modern dental practice has grown in complexity over the past 20 years. This is due primarily to an increase in patient flow, the increased use of dental auxiliaries, and the proliferation of third-party payment plans available to patients. As a result, the dentist is called upon to be both a skilled manager as well as a clinician. Our guest today is a veteran management consultant of some 13 years to businesses of all kinds, including dentistry. Dr. Charles Strawn maintains a private practice as a dental management consultant and is an assistant professor in the dental practice management program at the University of Michigan. Dr. Strawn, the dentist indeed must wear two hats in the operation of a successful practice today. How do you view the relationship of the dentist as a clinician and as a manager?
Actually, I don't think a dentist can really be a good clinician unless he is a good manager. And in fact, I think the two are really very similar skills. For example, as a clinician, the dentist has to get involved in developing patient relationships, and those have to be good interpersonal relationships that the dentist can build on in order to develop the diagnostic treatment that's required. The manager has to learn how to communicate effectively with staff and patients as well. The clinician has to learn how to do diagnosis. In effect, that's another skill that the manager has to apply to his organization, for example, in problem solving. The clinician...
To identify the problems to begin with?
Of the business?
Yes, in the business area. You mean he has to be able to diagnose the problems of the business, per se?
Yes. He has to understand that running a business means solving problems and making decisions. And the decisions, of course, are the third skill that the manager has to develop. And the clinician has to make decisions as well. So from a skill area, the clinician develops skills in communication or patient relations, diagnosis or problem solving, and decision making, which are all three skills that a manager has to have. So in effect, there's the skills are simply applied to a different setting. The clinician applies them in relationship to the patient. As a manager, the dentist applies them in relationship to his organization.
So he must indeed wear two hats to operate a practice, and yet is applying similar skills. Is that?
Yes, the processes are very similar, although the activities that are required are different. But the processes are the same. Treatment planning, for example, is a very basic skill that's required for the dentist to function as a clinician. As a manager, planning for his organization, setting up the objectives, deciding how to get there, and then organizing the resources in order to get there. In the clinic, the operatory has to be set up. The dentist has to decide how to schedule the patient, get the patient in when the operatory is free and an assistant or at least the equipment is available that he or she needs to use. And in running the business, he or she has to organize the resources in order to achieve the objectives that the business is trying to achieve.
Do you think that dental graduates in general are aware of the need to be well organized as a practice manager, or are they fairly preoccupied with the technology of dentistry, if I can state that?
My own experience and my own observation is that dentists in general, not just students, but certainly students, tend to be preoccupied with the clinical aspect of practice and try often to avoid or get someone else to take responsibility for actually running or managing the practice, which I believe is a serious mistake, because it's not possible for someone else to actually make the kinds of decisions that have to be made in a well-run dental practice.
I'd like to back up, if we can, and just touch on this area of management. You deal with it on a daily basis. How would you define management? Just what is dental practice management in your view?
Dental practice management is really knowing how to control the dental environment in such a way that you're able to do what a dental practice exists to do, and that's prevent dental disease, provide education to the patient, repair the result of disease or restore the result of disease, and being able to do that in an effective and efficient way. And in order to do that, really, I think the manager has to understand that there are different components of a dental practice. For example, production. Unless the dentist is actually involved in production, and by production I mean hands-on activity with the patient of some kind that the patient is actually paying for. In fact, that's the only way that a dental practice can survive, is that the dentist is doing something with the patient. And in order to have some kind of production going on, there has to be a marketing activity. In other words, there has to be a contact by the dentist or the dental team in some way with the environment or the community or the society. And that is a marketing function. And in order then to, once the patient is in the dental office or in the dental practice, there has to be some kind of logistical backup activity, which is a third component of the dental organization, to provide the support services so that when the dentist starts working with the patient, they've got the materials and resources that they need to actually provide the care. And then kind of providing an umbrella for all of that to kind of provide the information processing. There has to be the administrative component that kind of keeps all of that together, gives the dentist a way of monitoring what's going on in the organization, and some way of keeping tabs of what's happening. And then all of that, of course, is held together by the management function, which involves a variety of activities that are designed to help keep that organization and those four components sequenced and integrated in a way that the end result or the objective of the dental practice is actually accomplished.
What are some examples, dental examples, of production activities?
The various kinds of procedures that are done, for example, crown and bridge, oral surgery, various kinds of operative procedures, preventive techniques that are applied, patient education, anything that's done with the patient there that the patient is actually paying for, you know, some kind of service that they're expecting to receive.
And those activities, those production activities, are the sole income?
That's the only thing that generates income for a dental practice.
You mentioned marketing. What are some examples of marketing activities that a dentist would have?
Marketing is probably one of the weakest areas in most dental practices. I think that's in process of change with the new opportunities in advertising and so forth. But at present, scheduling is one of the primary sources for marketing activity. That's the contact with the patient, in which they are scheduled to come into the practice and so forth. And so the activity that's done by the receptionist, for example, and talking over the phone with the patient is a primary marketing activity. Recall is another kind of marketing activity.
The interaction with the dentist in the community would be construed as a marketing activity if the dentist was involved in social clubs and that sort of thing.
That's a marketing activity. However, it tends to be a little more indirect unless the dentist is actually planning that kind of activity in the community for marketing purposes.
As a strategy in building.
Otherwise, it's really more of a social activity than a direct marketing activity.
Logistics. What are some dental examples of logistics?
That has been changed a little bit with the increased utilization of dental laboratories, because the lab work is probably the basic logistical backup for dental office production. X-rays, I guess that would be a kind of a primary backup.
Would you consider
activity.
Laboratory activities, casting of inlays and that sort of thing, logistical support?
Everything that has to do with preparing materials or the setup for the actual hands-on activity with the patient would be considered a logistical
operatory
activity.
Preparation by the auxiliaries.
Yes.
And that sort of thing.
That's a logistical backup support activity that is required in order to effectively carry out the operatory procedures.
What would you consider, when you mentioned the umbrella concept of the administration of this activity, what kinds of things would be included in that administrative function?
The primary function of the administrative area or component is to actually process the information that is available to the practice. Now that involves a variety of things. Two of the primary sources of information or pieces of information that have to be processed are the financial records of the practice, but in addition, the patient records, for example, would be critical information. The administrative area would also handle the processing of insurance and the billing, that would handle the correspondence area. In other words, everything that has to do basically with the paperwork of a modern organization would be under the kind of the umbrella of the administrative component.
Would you consider analysis of the records of the practice, such as the appointment book from previous years, inventory records, to see how one is doing in terms of consumption rates of supplies, time allocation for services rendered? Would that fall under the umbrella of the administrative activity, or where would that fall?
Actually, that's a management function as opposed to administration. Administration would have the responsibility of collecting that information, keeping track of it. The inventory control system would, for example, would be an administrative activity. But the analysis of that information is a management function. Management is involved in, well, one way of conceptualizing it is in 5 different kinds of activities: planning, organizing, staffing, directing, and controlling. And the analysis of the information that you have in the dental practice is basically a controlling function of the management process.
Do you think dentists are good analysts of their own practice?
My own experience is that that doesn't happen very often, frankly. There are some dentists who really do pay attention to that and do a very good job of it. But for the most part, that's viewed as a rather tedious chore, partly because I think it isn't connected up with what its objective is or what it's supposed to accomplish. It's as though they're just looking at paper or figures on paper, and they don't understand how to use it, and so they tend to push it aside and not pay too much attention to it. Perhaps at the end of the year, they look at their annual statement and see whether they made a profit or a loss, but by then it's really too late to do anything about it. The primary purpose of the controlling activity as a manager is to look at that information on a periodic basis so you can take corrective action and get back on course to achieve your objectives before you've gotten so far out of line with them that it's impossible.
When you look at the model that you constructed on management and the activities that are included in that model, it seems at first glance that the time allocation for management activities would be rather substantial. Could you give us some idea of how much time should be spent in purely management functions in an operation of a practice?
Okay, one of the problems that I think a lot of dentists get into is management by crisis, and that generally means that there's a lack of management and they only do the management activities that they're forced to do. So consequently, they spend inordinate amounts of time in management activities that is spent needlessly. In other words, they could accomplish much more and spend a lot less time. My own kind of rule of thumb is that any dentist who spends more than 10% of his or her time in management activities, that would mean essentially on for a 40-hour week, 4 hours a week, is not doing a good job managing.
Is that guideline the same for a beginning practitioner as well as a veteran practitioner? Does that change as the practice is established?
Part of that, I suppose, would be a function of the skills of the person involved. I think probably as the practice becomes more complex, it would require more management activity, but at the same time, if the dentist has been developing his or her skills, then they can do more management activity with less expenditure of time. But that time that I'm talking about in terms of management activity, that would include staff meetings, That would include spending time with the financial statement, analyzing those, and of course there are ways of doing that so that it reduces substantially the amount of time that's required. In other words, you need to have some way of summarizing that, and there are mechanisms for doing that, so that you don't have to spend hours just poring over a lot of figures. As a manager, the dentist should be able to take a few kind of summary ratio analysis formulas to monitor the practice and would not spend a great deal of time poring over financial statements and so forth.
We'll be back with our continued discussion on dental practice management right after this important management fact. We've been talking with Dr. Charles Strawn about dental practice management and the relationship that the dentist has in the various activities within the dental practice relative to management and clinical activities. Dr. Strawn, what are some of the problem areas that you see in this domain of managing a dental practice?
I think the biggest problem is created not so much by the management itself or failure of the management, but by kind of undercutting some of the need for management by not understanding that the dentist working in a dental practice or owning a dental practice has not just created a job for himself. A lot of dentists kind of operate in their practice as though all of the income that they get from it is just paying them for the job that they're doing. In fact, that sets them up for a serious problem, that they forget that they've made a tremendous investment, and that's what the purpose of the organization is to generate a return on their investment. It's always amazes me somewhat that a dentist will invest $10,000 in the stock market and spend hours reading the Wall Street Journal and poring over analysis of the stock market and so forth to get a return on that, when they've invested $100,000 or more in a dental practice and act as though that's going to take care of itself. And in fact, the primary purpose of management is to provide or to monitor and manage and generate a return on the investment from the organization itself. And the dentist's salary should be viewed as a legitimate market value that should be obtained by the dentist from his own practice at the same level that he would be able to get if he or she would be working for a hospital or another dentist or what have you.
Are you saying that if a dentist invested $100,000 in establishing a practice, that dentist should look at the $100,000 returning a certain percentage?
Yes.
Okay. Let's, for example, say 10%, if that's what they could get, you know, in the money market situation.
Right.
So they should set aside that and say, my goal is to get 10% on my $100,000. Now, what salary do I want out of that practice? Do I want to make $40,000 a year? That should be their salary goal.
Well, the salary goal should be based on a reasonable market value. You know, I mean, just to grab a salary goal and set it, I think that may not always be appropriate, but it certainly should be no less than what the person could get working for somebody else.
Someone else, yes.
And then the return on investment should be over and above that. But I think continuing along the line of the problems that are involved, I think that's one of them. I view that as kind of creating some of the others, because the dentists don't understand the necessity for managing their organization. They just view that as the place where they work. But in addition, I think that one of the more serious problems that they get into is not being willing to or actually being psychologically unable to delegate responsibility. It seems somewhat strange that a staff will be hired to do a job and then the dentist finds themselves unwilling to actually allow that person to function.
Why does that happen?
I think part of that grows out of what I would characterize as a third problem, that there's a tendency not to value competence. A lot of dentists, for example, given a choice between an untrained assistant and a trained assistant, will hire the untrained because they say, we want to train them to do it our way. And if we get somebody who's somebody else is trained, they won't know how we want to do it. But they fail to realize that training in a professional team accomplishes more than just knowing how to do an activity. It deals with an attitude. It develops a sense of professionalism that someone just coming in off the street will, even though they may be able to do the activities, will have much more difficulty developing. And it's also much easier to adapt someone who is trained and is competent to do a job within a different kind of setting than it is to train someone who does not know how to do the job to perform the same activity, and certainly much less expensive because it takes less time.
It seems to me that the dentist then assumes a greater workload for the operation of the business than really they would have to.
Exactly, and that really kind of points up the fourth problem that I would identify that in terms of its seriousness, and this kind of hides the cost of that increased workload, because many dental offices do not have adequate ways of controlling their practice. In other words, they don't have ways of monitoring what's going on. They don't know what it costs them, for example, to fire someone and replace them. They don't know what it costs them to actually train an employee.
On the other hand, too, it seems like that would lead to more turnover from the auxiliary's point of view in terms of the individual not being challenged by their job, being given mundane activities instead of really challenging tasks to perform, and it seems to me that that would lead to turnover.
Yes, I believe it does. Whenever you hire somebody who is competent and then don't allow them to do the job that you hire them to do, it creates dissatisfaction and so forth. And you know, that I think kind of points up another one of the difficulties that a lot of dentists get into, and that's really not because they don't value competence. They're not really willing to pay the kind of money to their staff that they really need to pay in order to get competent people. You can get what you pay for, and I emphasize can because that's different than the statement that generally gets made, you get what you pay for, because you don't always get what you pay for. You can pay a higher salary and still not get competence. Getting competence is a rational process. It's a selective process. You hire people who are competent, but then you pay them what they're worth.
Sometimes I think dentistry is missing the boat on getting the higher caliber of competent individual in the area of dental assisting, for example, because of that. Programs that are involved in training dental assistants have difficulty in getting qualified people to come to those programs because they look ahead to what income that is being offered by the dental profession, and in many instances it's very discouraging when they compare their program with X-ray technology or inhalation therapy or some of those things where salaries are considerably higher, and so these competent people will then move into those other career pathways and leaves dentistry in a lurch, you know, for the number of competent people that it really needs. So it's kind of creating a long-run problem.
Yes, I would agree.
I'm interested in your comments about the relationship between good management and the quality of dental care that a dentist would provide for the public.
I think it's impossible to separate the two, frankly, because quality of care is, I believe, a function of not only the competence of the dentist and the dental team that's involved, but also the environment that they're trying to operate in. A dentist who is trying to perform quality care in an atmosphere of stress, of anxiety, of hostility, is just not going to be able to function as well, even though they've got the competence to do so, as they would be able to if they had an environment that was relaxed and supportive, and which the patient as well was relaxed because of their sensing of the kind of uptightness of the staff that, you know, that gets communicated to them when they come into the office.
I've had dentists comment from time to time that practices that are operating with multiple operatories, large staffs, are engaged in what has been referred to as roller skate type dentistry. The dentist, you know, quickly moving about the office, and a connotation of a lot of stress and so on and so forth. And I don't think that that's what we're really talking about here. It seems to me that we're talking about a little bit more control to relieve stress. Is that
yes?
Relationship?
Production and quality really kind of go hand in hand, in my opinion. Increasing production does not mean just speeding things up. Increasing production is a results, or being able to increase production results from creating an environment in which people are able to do their jobs more effectively. And consequently, it reduces the number of false starts, for example, because you're able to concentrate specifically on what you're doing. You're able to do it much more effectively the first time you do it. Where if you're, if you've just had an argument with the assistant or the receptionist, and you're sitting there trying to carve an amalgam or prepare a tooth for a crown, and you're still thinking about what just took place between you and your assistant, you're not concentrating on providing care to the patient, even though that's what you're wanting to do and that's what you're there trying to do. You're preoccupied, and so that's going to slow you down. It's going to decrease your ability to produce what you're capable of producing, and as in the long run, I believe, affects the quality of the care that the patient is receiving as well.
In addition to that, it seems as we've been talking here that we're talking about management as a philosophy that extends beyond the dental office, that it extends into one's personal life, considering the amount of time that you spend in your work. Is management really a philosophical thing, something that does indeed relate to a way of life for the practitioner?
In reality, management is the ability to control your environment, and I think that's a basic human need. That we have a need to be in control of the environment that we're going to exist in. When we live in an environment that seems to be pushing in upon us or pushing us down or trying to destroy us, it becomes very difficult to feel satisfied and fulfilled with our life. When we feel like we're able to control that environment and manipulate it in ways that meet our own needs and the needs of those who, that we care about, then we feel good about our life. And so being a good manager, in my opinion, is really being able to function by learning the skills that allow you to do so in a way that allows you to fulfill your objectives for your own life. And frankly, it seems to me that the place where you spend most of the time of your life, and if you just stop and figure it up, most of your time is spent where you work. Even though you spend more hours someplace else, for example, for most people, 8 hours of the 24 you have are spent asleep. The other 8 hours are spent on your own time, but generally that time gets very fragmented. Even the time that you spend with your spouse, for example, if you happen to be married, is not really time spent just kind of face-to-face contact. One of you is out in the garden while the other is in the kitchen, or you're doing different activities even though you're together. Well, the place where you work, you're all functioning together as a team with one specific objective that you're all working toward. And so that means there is where you spend most of your time. And I just believe that the place where you spend most of your time should generate a sense of personal satisfaction and fulfillment that makes you feel good when you leave there. And management, good management, allows that to happen. Bad management doesn't. It actually detracts from that.
Thank you, Dr. Strawn, for your very interesting comments. Our guest has been Dr. Charles Strawn, an assistant professor in the Dental Practice Management Program at the University of Michigan. Please join us again for other programs in this continuing series that are designed to assist you in the operation of a successful dental practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.